Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together, we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
Good morning and happy Mom Day. It's just me today as Karlee is at work, but I'm here with guest Dr. Rachel Ollivier, and she is a nurse practitioner full-time, and you work at the BC Women's Hospital, and you work in postpartum, well, you focus in sexual health in the postpartum period, and we're super excited to have you today, so welcome to the show, Rachel.
Thank you so much, Jen, and thank you for having me.
We are excited to have you on. It's kind of fitting because I'm literally going through this postpartum sexual health period right now. And I just had my 6-week checkup. And so I think we'll have lots to talk about today, which will be great. But maybe you could just introduce yourself and tell us kind of how you got started in this line of work.
Yeah, so my kind of time in research started back in 2017 when I started my master's degree at Dalhousie and then bridged into the PhD program there. But really, when I was looking at some of the topics that I wanted to, focus on for my research, I knew I had an interest in global health, in maternal health, sexual health, and had a bit of kind of a volunteer experience through Options for Sexual Health BC in my undergrad as well with the sexual health piece. And as I was looking in the literature of some of the gaps that existed in research, I started to think a little bit about the intersection perhaps of maternal health and sexual health, and really thinking about that postpartum context because we know there are so many changes. And so I was curious to see what was in the research and what was in the literature, and found that there were many gaps and it wasn't really discussed in a very holistic way, and really kind of tended to focus, if at all, on sexual activities or contraception. So it kind of got the idea spurred that I wanted to do some qualitative research in this area to really deepen what we know about how people experience their sexual health in the postpartum period. Yeah. And started with that and had the mentorship of my supervisors. And it's now turned in, of course, to a passion of mine and also an area of expertise. So I'm, so thankful to be here to talk about it today.
I think it's very important. It's definitely something that I've noticed that there's a gap in. Especially, I've talked about this on the show before, but having endometriosis, vulvodynia, vaginismus that does affect my sexual health, it's something that no one talks about. And I found that I was very shameful about it in the beginning because I'm like, no, I've never heard of anyone that had these. How come no one's talking about this? No one's talking about pain with sex and having all these problems and pains down there and, issues. And so I started to do some more research, and I actually went to BC Women's. They have an endometriosis clinic there. And they had a support group, and just talking with other women that have it, you realize like, oh, this is actually common. Like people do have this. It's not just me, and that it's okay to talk about this. Other people have pain while they have sex. And there's another big component of after having children, how things can change. And you might have some of these new pains because things have shifted, or maybe you didn't know that you had some of these undiagnosed conditions. And so it's definitely something that I feel passionate about because I felt very alone in this years ago, and I was like searching for people who would care to talk about these things, and I found that there was a big gap in that. So I'm excited to talk about these things today. But maybe before we get too into it, can you just define sexual health? Like, what would you say is that definition of what you study?
It's an interesting question because I think you'll get a bit of a different answer no matter who you ask.
Fair.
But really what I base my research off of is the World Health Organization's definition of sexual health, which has been in place since 2006. And they define sexual health as being mental, social, relational, physical. And that's really what I kind of draw from their definition, is the fact that it is a holistic aspect of overall health and well-being, and impacts, not only the physical pieces, but also, as I said, those emotional and mental components as well. And it's no different in the postpartum period.
Yeah.
Really, I think in terms of what we know internationally, funny enough, there isn't an internationally recognized definition for sexuality, but there is one for sexual health. And so really when we kind of look at that, it's nice to kind of have, a working definition. But of course, it really is also influenced so much by cultural factors, religious factors, geographical location, social context, all these things also play into how sexual health is not only defined, but discussed and approached.
Yeah.
And so I think with that, again, the variety in those answers is huge, but that's sort of how I seem to approach it in not only my clinical work, but my research.
Yeah. No, I think that's sounds great that you take it as a holistic approach, because there is a huge mental aspect is what I've found. Like for me and for your relationships as well, there can be a mental aspect. It can directly affect your relationship. So I feel like it's good to talk about that piece as well, not just the physical anatomy, what's going on piece about it. But I think this brings us into kind of the first question of that 6-week checkup. And I know that you say you talk about this a lot, but as someone who just had my 6-week checkup, I can tell you that it was, and I went to I loved the place that I went. It was a midwife clinic and they had an OBs, nurses, like great staff, but it was a very quick visit. No one really asked me anything. Like they only looked at my scar because I have a stitch, like my C-section incision, because I have a stitch. So they looked at it. And they talked about contraception. And I said, like, we're not having any more kids. I got my tubes out. And they were like, oh, yeah. And then that was really kind of it. Like, it was just interesting. It's a very short appointment and they don't really talk about much. So I'm curious your thoughts on the 6-week visit, or what are we missing something? Like what should be discussed in this appointment?
The 6-week check really is an interesting time because I think based on what was found in my research, people, postpartum really do perceive it as a time when I think they should or are supposed to be feeling ready for sex. Mm-hmm. And usually are not. I think for a lot, again, in terms of sexual health specifically, it felt like a very arbitrary time. Mm-hmm. It was kind of perceived in different ways. I think for some, the meaning of it was one that really was about having it feel kind of, it could be like a milestone in more a positive sense where it's like, okay, 6-week mark, we've, made it this far, yeah. Kind of having a little bit of a return to normalcy, in some ways, or sometimes not at all. But, for others, it really felt like a bit of a deadline in the sense that it felt too soon. It felt rushed. It felt like it didn't fit with where they were at, I think, especially emotionally. So when we look at kind of the medical 6-week check and what's expected in terms of that, I think, as you said, and as it seems to be paralleled in your experience, if and when sexual health postpartum does come up in those conversations, it's often focused on contraception of, okay, do you want to prescription for birth control? Okay, here you go. And that's it. That's where it ends.
Yes.
But we know that there are so many questions that people often want to discuss related to not only their sexual health, but many aspects of being postpartum. And part of kind of that physical assessment as well. In my research, going to the 6-week check, a lot of people did value kind of getting that green light or that green check mark from their healthcare provider in terms of, okay, it's now safe to return to sexual activity, which we actually know people can return to sexual activity before the 6-week mark. There actually is not any medical literature that states the 6-week check is that magic number.
I was going to ask
from a medical
that.
Perspective.
Interesting.
Yeah,
I was wondering
so
where this 6-week came from in terms of being able to have. So it's just. It's a number. Like it was just
it's kind of one that I think sexual health kind of got brought into that umbrella because it's a time when we happened to check up and see how things were going.
Good.
And yeah, it kind of somehow became this thing. But even medically, a lot of healthcare professionals also are not aware of that and do believe that the 6-week check is how long people should wait. When in fact there actually is no support for that. Usually, we want, say, any incisions or things like that, if people had an episiotomy or any tearing or things like that, to be healed just to minimize any risk of an infection.
Fair.
And, the uterus does go back down to size by the 6-week mark. Okay. So there are some kind of physical things that we're looking for in terms of just general recovery.
Okay.
But in terms of returning to sexual activity, that is something that, yes, a healthcare provider can assess, your incision or your, perineal healing or your pelvic floor muscles, whatever that is. But, things like pain, things like emotional readiness, those are subjective experiences that only the person can tell us, and it's only for the person themselves to choose, right? So I think that's also sort of where it comes up. It can feel a bit like navigating different things, different messages, where you're saying, okay, I'm getting that green mark from my healthcare provider, but I'm still not feeling ready. And so what do I, how do I navigate that? How do I not navigate maybe that, internal dialogue, that conversation with my partner, all those things. So again, the 6-week mark is loaded. There's a lot that often kind of happens right there. And again, you're being assessed and all these things.
Yeah.
But yeah, really the sexual health piece, it was a meaningful time period for people who were in my research. And really was a time when they were starting to think about their sexual health again and had a lot of questions about it.
I find that there's a lot of pressure put on this 6-week mark, like in terms of, okay, like 6 weeks now you should be having sex. And it feels like pressure that I need to make that decision because I reached that point. And I think that it's a bit of a just societal pressure that, okay, I need to bounce back now. Like now I got my 6 weeks, I should be exercising. I need to go and start doing all of these things. But I have not felt ready I went for a walk on my 6-week mark because I was like, I can't work out and I want to. Like that to me is a huge stress reliever and helps with my mental health. And I have PTSD and it's the number one thing to help my symptoms of PTSD is exercise, and I just haven't been able to do it. And I'm like, I know this is good for me, but I'm not there yet, but I feel pressure to do these things. And so it's interesting that the 6-week doesn't really have a lot to do with the ability to have sex. And I can see the physical, like the healing aspect, it makes sense. But I know women that have had lots of, I guess, issues for lack of a medical term, but like prolapses and things that have changed and happened in birth. And so 6 weeks isn't enough time. And especially for the prolapses, there's now procedures and things that they have to get done. And so for them, it was like, I haven't even thought about it. Like I have so much healing and work I need to do that like that's not even on my radar now. So do you think that maybe there's room for us to add to this 6-week appointment, maybe talking about pelvic floor therapy? Because I know people that they don't even know that you could do pelvic floor like health assessments, and they're not aware that those are, normally covered by medical benefits, that it's more readily available too. There's a lot more clinics near me, like in Langley, Maple Ridge, Abbotsford, that do these assessments and really focus on women's health and postpartum. So I'm just curious your opinion on if we should kind of be adding those things into our 6-week checkup.
I think absolutely there's, a huge benefit to it. And when I talk to healthcare providers, whether that's, physicians, midwives, nurse practitioners, about this topic, it's often something that, I recommend approaching with a very open lens. And, what I mean by that is having it kind of be an open question. So something like asking, how are you feeling about your sexual health right now? Or what are your thoughts on your sexual health right now? Because it allows the person to kind of bring forward what they define as being part of their sexual health and what they want to talk about, rather than having me as the healthcare provider be the one to decide that. Again, sexual health is so individual. It, is fluid throughout the lifespan. It ebbs and, changes so much.
Yeah.
So with that, it not only obviously opens up the conversation and lets the patient kind of lead what is discussed in that, but also sends the message of, yes, this is an important component of overall health and well-being. And, I think it's difficult, on the medical side as well. We have, these fixed time appointments where we're trying to get through so much that's at the 6-week mark. It's already, again, a lot to cover.
Yeah.
But I think just adding even that one simple question can allow us to discuss things, even if it's brief.
Yeah.
And then kind of, have supports and resources like the pelvic floor physiotherapy that, a lot of people don't know about. And again, there's all these wonderful community resources that often can be very helpful. So it's that piece of just getting the connection going and having, follow-up treatment or, referrals or whatever it is.
Yeah.
I think it really is something that, again, is so important to postpartum health and well-being and does not usually get acknowledged at all. And if it does, as you said, it's on contraception.
Yeah.
So no, it's those easy tools as well, I think, for healthcare providers to meaningfully incorporate it into their visits.
Yeah.
While still being realistic with the time constraints that we all know can hinder experiences, both, not only for the healthcare providers and of course for patients and their families. So,
yeah, because it was interesting. I did do the postpartum depression scale, the questionnaire at the appointment.
Okay. Yep.
But it brings up a good point that it could be easily added on to that. Like when you're talking about your mental health, like, how are you feeling about that? Like, I like that you phrased it as it could just be one simple question to kind of get those thoughts going, because for me also, there's the piece that I do have PTSD and I'm on medication for it, and my medication changes. It affects my libido, but not a lot of people, I think, connect that piece to taking medication. So some women that maybe are experiencing postpartum depression and have been prescribed medication might not realize that that's going to affect their sexual health as well. Because I know people that have started medication and didn't know that, and then they're like, wow, like I don't want to be touched, like I don't want to have sex at all, like, or I can't have an orgasm, and like it affects all these things, and they think that there's something wrong with them because they just never knew there was a correlation. And I also am on domperidone for breastfeeding, but I recently learned that can affect your sexual health as well. And I'm like, interesting that there's medications that are fairly common prescribed postpartum for various reasons, but they're affecting your sexual health. And I'm really I don't hear that this is talked about enough or a lot. Like no one really seems to be talking about this. So I just curious your thoughts on kind of how that mental health and the medication piece comes into play as well.
Absolutely. Can, yeah, as you said, be very affected.
Yeah.
And, based on some studies that were done in 2017 and 2018, we know that people who experience mental health changes or depressive symptoms during the postpartum period are 2.5 times more likely to experience sexual health issues as well.
Okay.
So absolutely, there is a correlation there. And kind of even knowing those changes of what to expect. So for example, if someone is, breastfeeding or nursing and, is having that experience postpartum, it can affect, numerous things, including, body image, body function, how you see that, part of your body perhaps, as well as, have some physical implications in terms of your sexual health as well. So something else that isn't very well known is, how milk production and the hormones associated with that can affect your vulvar and vaginal health. So vaginal dryness is quite common during that postpartum period.
I didn't know that either.
So that's something, exactly, right? And because no one tells you, right?
Yeah,
so it's sort of something that, again, all these changes that are happening, it's hard to know, okay, what is normal, what's not.
Yeah.
And then also the variance within normal. We know that there's such a variance within, quote unquote normal.
Yeah.
But it's hard when those experiences aren't talked about. Medically, they're not acknowledged. So then there aren't really reliable sources of information to understand, to help people explore, okay, is this something that, is normal, is expected or not? And then if not, what should I be doing about it? Or who can I ask? Who can I talk to?
Yeah.
So, of course, any medical treatment is part of that, including the effects of medications, whether you're postpartum or not. So it is, but it's a lot to navigate and know what's what, because especially if it's, your first birth, it's all new. It's also so new. And we know even between, births, the experience is so different.
Yes.
So no, absolutely a lot to navigate.
Yeah. And it's interesting, like just, Karlee and I have made a point to make a lot of mom friends and create this village that we're all going through very similar things at the same time. And we're very open, like the whole group that we've met, like we talk about these things. So we've all talked about our sexual health postpartum and when we felt ready. And we talked about these as it was kind of going on, but it was interesting, the varied response from people. Because one woman, and I loved the way she said this, she felt like it was feng shui down there, but in a good way. Like she felt like things moved in the best way possible, and it was great, and she felt ready, and it felt amazing after having a baby. But then there was the complete opposite, where people were like, no, all of a sudden it was painful, and it did not feel good, and it felt like it was, things moved around in a worse way, in a not comfortable way, and that it was quite painful at first and they had to get used to it. So I just found it quite interesting that there's such a variety of responses. So I guess that makes your job hard, because how do you, there's no quick answer because there's so many different responses people could have then.
Definitely. And it does absolutely vary on the, physical component and healing and mental, emotional, all those things. And even within someone's postpartum experience, they can kind of, have those ebb and flow moments where sometimes they're feeling, more positive or ready about, sexual activity or sexual health.
Yeah.
Other times where it can be very difficult. I think, in my research, a lot of people did discuss that, I think, again, the lack of information and the difficult journey that it was in terms of pelvic floor recovery. I interviewed some people who had, third or fourth degree perineal tearing from the delivery. And so really were, I think at times, one participant kind of used the language of feeling hopeless or feeling stuck. and knowing, okay, are things ever going to go back again? Like, am I going to be able to have sex again? Things like that. So it can really vary where, you're worried about things like that, or for others, it's kind of a time to rediscover their bodies. They, might experience sensations quite differently. So for some, in my study, they were talking about masturbation and how that was kind of a nice way to explore their bodies, explore their sensations, while still feeling comfortable and safe, especially because there was a bit of a fear of pain with, returning to sexual activities. So that was a way that they kind of, negotiated that sort of time period, and trying to find what was best for them. But it's also, I think, very tied to, one's comfort overall, even pre-pregnancy or during pregnancy, with things like sexual health. And, it's so positive to hear stories like yours where, despite the challenges and hurdles a little bit, you have that network of support. Because I think also what comes up in, when we're talking about anything maternal health, and some of my supervisors have done research on maternal support networks, but some of those spaces, especially virtual, are not always friendly in that sort of way. I think a lot of times in a lot of spaces, moms can feel very judged because it feels like no matter what you think or what you feel, you're somehow in the wrong. If you like your stretch marks, if you don't like your stretch marks, either way, there's judgment there sometimes. So finding those trusted relationships or people who could relate to their experiences was something that the participants in my study really felt was important. So that usually kind of was close friends, or fellow moms that they had kind of developed a relationship with, who again, they felt could understand and relate to their experience without having that judgmental lens. We know that sexual health, among many other topics postpartum, are important to talk about. And so again, creating that space for, for each other, finding that space for ourselves is, I think, also a critical piece that can be positive to sexual health.
Yeah, it was interesting that I didn't go, but we always have gone to this postpartum support group we did for the entire year that Karlee and I were off. And one of the ones I missed, but it was a clinical counselor who dealt with sexual health. And she always said, the first person who should be touching you postpartum is yourself. Like, you should touch yourself. You should learn how it feels. Does it feel different? And like, is it painful? And Karlee told me that. And I was like, I like that. She's like, the first person who should be touching you is yourself. And it was just like I just liked the way that she phrased that. And I appreciated that this was a postpartum, one of the postpartum support group topics, is that she came in and talked about this, because I think in a very non-judgmental, completely open way, because I think people are still scared to bring it up and to ask these questions. And that's kind of why Karlee and I started this podcast, is because we want to talk about these things that people don't always talk about. And we are just open books, and we will share our journeys. And for me, literally, I just didn't say anything for years to people about having pain with sex, and I couldn't even put a tampon in. And how do you say that to like, I felt like I was like, there was something so wrong with me, and like, I didn't even want to tell a doctor because I felt like it was just like, I was so uncomfortable that I couldn't say these things. And then I learned that, there's actually a condition that's causing this. Like, it was a normal, it was a reason that it was happening, and that there's things that I could do, and that there were resources. But I really didn't feel supported till I went to the clinic at BC Women's, because they did the support group and they talked about it like it was the most normal thing ever. And that was finally when it clicked to me, like, we can talk about these things. Like, sexual health is normal. Why aren't we talking about this more? Like, this can help so many women. And since then, I've met all of these women who have been like, it's so nice to talk to someone about this. And so I think it's really cool that this is your area of research and what you've been working on, because I've just noticed such a gap in talking to people in my own experiences. And then, you have a baby and your mind is going everywhere and you're already struggling. Really, the first 6 to 8 weeks are hard with sleep and breastfeeding. So to add in, if things aren't feeling good or if you're feeling pressured, I especially, and maybe this is something you found in your research too, like, my body, I'm having a hard time dealing with, especially the second time around, postpartum body issues and not being happy with my body. I have a lot more stretch marks. I'm not comfortable again. Like, it's only been 6 weeks, but I'm just starting to have these I'm just not loving it. And so to even think about wanting to have sex, who wants to have sex when you don't even feel comfortable with your own body? So did that come up a lot in your research, that aspect of, kind of postpartum body issues as well?
It definitely did. Yeah.
Yeah.
And it was really one that I think for some people it was. It felt, I mean, as you're kind of saying, they said, I don't really feel sexy right now.
Mm-hmm.
But also it felt kind of like this period of, I remember some kind of saying, I feel like my body, I don't recognize my body, or that,
Yes.
my body's kind of new.
Mm-hmm.
And so it felt like this journey of kind of almost trying to reacquaint themselves with, what things were like now, not only in terms of kind of how they looked,
Yeah.
and maybe having different perceptions of the breasts, if they were, nursing, and, nipple changes, size changes, abdominal size changes, and shape changes, and all these things.
So many.
And so it was something that definitely was relevant, I think, because it, again, was sort of, I think, very tied to their sexual health and sexual identity.
Mm-hmm.
And it wasn't even always acknowledged kind of prior to pregnancy. It was just the way things were. This is the body I've always had.
Yeah.
And then postpartum, that's sometimes flipped on its head.
Yeah.
So it was kind of, again, definitely a journey, in terms of kind of, having the changes, saying, okay, this is, my body now. How do I still feel good in it and appreciate it for all the work that it's done in creating this new life, and enduring a pregnancy and birth and all these things, right? So some people did, feel power in that, in terms of having, they say, my stretch marks to me represent, what my body went through. This is part of showing what my body's experiences have been. Same as a surgical scar, same as an injury scar.
Yeah.
So there's different ways, but it's kind of, and it's tough because I think online it's really pulled apart of being, you have to be all positive about all your changes, embrace. And then others are kind of like, bounce back, get back on that grind, like you go.
Yes.
And it's tough. It's sort of like, okay, as a mom, where do I fit in this? I'm not really relating to either sides of the spectrum.
Yeah.
And being able to talk about that too, because I think it's okay to feel those things of feeling like, okay, this does not feel like my body. I don't feel great about it.
Yeah.
And finding kind of that way, and hopefully still, having, whatever that is, a partner and who appreciates and, loves you, and finding that for, I think, yourself as well. So, but it's very, I think, related to overall sexual health and well-being in terms of sexual identity of your body, and then sexual identity as a mother. That also kind of came up of the binary a little bit, of identity as a mother and identity as a sexual being, and how those are kind of socially constructed in our society as being in opposition to one another. You can be one or the other, but you can't be both.
I never thought of it until I read it, and you had written it down, and I read it, and I was like, that's an interesting viewpoint on it that I never really put much thought into before. But you're right. Yeah, like, you're a mom. Like, you need to wear your mom jeans now, right? Like, you can't wear normal jeans. Like, mom jeans are now that's what you can wear now. And like your baggy sweaters, your yoga pants, your, with your Stanley Cup now. And like, it's, so it's interesting. I really love that you touched on that, because I never would have thought of that. But there is this push, kind of societal push, that no, you're a mom now. Like, it kind of takes you away from that.
Yeah, kind of becomes desexualized in that way a little bit. Yeah, but of course.
But then you also still need to be sexy and bounce back, and then but still look good, and there's no winning. It
all
seems
these
like
pulls, right? All these social norms and pulls that we have. Totally. So it is. People are navigating, a lot with that.
Yes. And I also, something else that I also hadn't thought about, that you had brought up too, is the idea versus sexual function versus sexual health, an idea like with breastfeeding. And I never thought of it that way either. I mean, I always had kind of thoughts in regards to breastfeeding, and I always thought I wouldn't really like it. It just seemed odd to me, even though it's a very natural thing to do. I don't know. There was some sort of wall for me with breastfeeding. And I couldn't do it with my first, and now I'm doing it with my second. And I'm like, this is the best thing in the world. Like, I'm loving it. But I could see that also kind of creating a barrier to sexual health if people are thinking of it as, like, I'm breastfeeding. This is I'm a mom now. And, like, using, I guess, the breast for the sexual functional piece, it can feel very separate. And then maybe it's hard to get back to that sexy feeling with them when you're feeding your child with them.
Yeah, using them in a very new way. Yeah.
Right? Like, it's
definitely. Well, and feeling, I think, for many who are, feeding, it's kind of can feel touched out for sure.
Yes.
Sometimes. And then also, with in terms of, their partner perhaps touching them or them touching themselves as kind of a sexual organ.
Yeah.
It was sort of, I think for some, they're sort of like, oh, that's right now they're for my baby. I don't really want my partner touching them, or they were, sometimes also just like, it's different in terms of how they feel when you're breastfeeding. And then having sometimes, especially when someone is experiencing sexual arousal or orgasm, there can be kind of contractions in the breast or some, milk leakage that can happen.
Mm-hmm.
And so for some, it was sort of like, okay, I also was not told that this was a thing.
I was not prepared for this.
Yeah. And
Yeah.
having some leakage when they're, with their partner or whatever. And, I think most of the time, hopefully being able to kind of laugh it off. But,
yes.
again, they're being used in, a very different way. So yeah, I think it varied for some. For some, they sort of said, I'm feeding my baby right now. Some were joking that they kind of felt like a cow.
Yep.
This is just what they're being used for right now. I don't see them as part of kind of my sexual body.
Yeah.
And for others, it was sort of like, okay, they can still be part of my sexual body, but when they are, they're also now,
yeah.
I now have cracked nipples and my breasts are leaking. And so, it can vary. It can really,
yeah, no, I can
but
see
again,
that.
so open to talking about it. So
no, I when I was first trying to breastfeed, and I guess my milk was just coming in and I was still trying to figure it out, I went to the bathroom and I was going to shower. So I was naked. I go into my bathroom and I sit down on the toilet to pee, and just my boot, like milk just starts coming out. And I just was like, and I called my husband. I was like, what's happening? Like, it was just like pouring from me. And I'm like, this is so weird. Like, it was just, you're navigating all of these changes. And yeah, I felt so much not like myself, and I wasn't in control. I didn't understand what was happening. So it's just, I could imagine if that happens during sex, being like, like it would throw you a little bit. But like you said, hopefully you can just laugh about it and it'll be a funny story later on. And
yeah, exactly.
Okay, so let's get back. I wanted to ask another quick question about the 6-week checkup. Are there any questions? Like, kind of guess, what's your best advice for people going into this appointment? What really should they ask or advocate for in regards to kind of how they're feeling?
I think in terms of the, physical piece, sometimes asking about what symptoms they can maybe expect or what changes are normal during that postpartum period can be often usually just a source of reassurance that things are kind of okay. But it's tough because, otherwise it's sort of like, again, there's not a lot of information on this. And so you're kind of left to, the Google rabbit hole that will, go into Reddits and people's experiences and all these things. So sometimes it's nice just to hear some of that information from a reliable source. And again, it kind of depends what people kind of have on their minds. I think sometimes it might be the more physical pieces of, okay, what should I know? And we'll talk about this a little bit today of, what are some of the physical things I can do or treatments or whatever to help, ease that transition into resuming sexual activity. Or counseling resources, whatever it is. So if it's, depending on kind of the component, I think getting connected through your healthcare provider is also something to bring up if you have interest in some of those resources, like sexual health counseling, like pelvic floor physiotherapy. They can facilitate that as well. So,
and what resources? So you're saying like pelvic floor therapy, which is great. I think everyone should go get an assessment done. But you said also sexual health counseling as well. Is there anything else? Like, those are two kind of, one physical, one mental aspect. Are there any other resources that you would recommend?
I think it depends sort of on people's communities. Sometimes, say if there's sort of what's going quote unquote sex shops in people's communities, again, usually more in urban environments than rural. But they can also be a fantastic resource for just information if people are interested in kind of that self-touch or masturbation component to kind of just get that familiarity with their bodies. Those also can be great. They're great sources of knowledge, I find, in any of those shops. So that's kind of another thing in the community. But in terms of caring for individual sexual health, for some people, again, they might often be experiencing vaginal dryness, especially if they're nursing. So with that, oftentimes I'll have the discussion of perhaps if an estrogen cream can be helpful. It does require a prescription.
Okay.
But that can help just kind of with vaginal tissue health and to minimize some of that dryness that's, again, caused by the hormones associated with milk production and feeding.
Okay.
But also vaginal moisturizers, things like Replens, Gynatrof, with daily use can also help, again, just help the tissue keep some of that moisture and to have a healthy environment.
Mm-hmm.
And then use of lubricant, I always recommend for, any sexual activities, whether you're postpartum or not,
Yeah.
I think is of course useful
Yeah.
for many folks. So with that, water-based or silicone-based lubricants are safe to use with an external condom, otherwise known as a male condom. And so those are also kind of, again, can be helpful in terms of facilitating comfort during any
Okay.
sexual interactions.
Yeah.
And silicone based, again, tends to be, I think, more preferred in terms of, my experience with recommendations,
Mm-hmm.
just because people find they generally have to use a bit less. Water-based lubricants, again, are, can be great, but also sometimes people feel like they have to use a lot because it gets absorbed quite quickly.
Because okay.
So I find silicone is kind of my recommendation there, silicone based, but lubricants, again, it can be great. Other recommendations that I make, personally to people is also just trying different positions.
Mm-hmm.
Things might feel very different. And then, there is also oftentimes a very real fear of pain
Yeah.
with resuming sexual activities postpartum. So sometimes, with any penetrative sexual activity, trying hand and knee positions or rear facing positions can kind of help to take some of that contact off the perineum, which for folks listening in is the area between, the vaginal opening and your anus, and is sometimes, often the area that can sustain injury during pregnancy or
Labor.
childbirth itself.
Mm-hmm.
So yeah, some of those positions, again, it's to each their own. So it's a bit of a trial and error,
Yeah.
but those are sometimes some of the positions that people will find more comfortable if they've had trauma or injury in
Yeah.
that perineal area.
Okay.
Also with pelvic floor, muscles, whether or not someone, delivered vaginally, cesarean, no matter what, throughout pregnancy, the pelvic floor muscles do weaken from, carrying everything. And then
Mm-hmm.
of course, during delivery itself can often be injured as well. So there's a big misconception out there. And, I hate that we use this word, but they use it, that, postpartum people are more quote unquote loose.
Mm-hmm.
When in fact, with the pelvic floor muscles, it's the same, muscle tissue that's in our bicep or in our tricep. And so when there's injury, same as kind of pulling a muscle, those muscles experience tension.
Mm-hmm.
And so in the pelvic floor, in fact, people can have more tension in that area, making it difficult sometimes to, insert a tampon, insert a finger.
Yeah.
It's can take a while to, have that recovery happen. And
Mm-hmm.
so that's also something I always discuss is, again, those kind of misconceptions about what those changes are in the vagina or the vulva
Yeah.
after birth.
Yeah.
So with minimizing, some of the discomfort that can happen, again, pelvic floor physiotherapists
Mm-hmm.
are a great resource. They are the
Yeah.
experts. It can offer tailored advice depending on
Yeah.
what your body specifically is experiencing.
Mm-hmm.
But in general, perineal massage
Mm-hmm.
prior to or kind of as a part of foreplay can also be great, just to help kind of relax that area, stimulate things to relax. Again, part of kind of the usually more positive things is with arousal, things can become more relaxed.
Mm-hmm.
Sometimes we see also with chronic pelvic pain, with orgasm, people can experience actually quite a bit of pain
Mm-hmm.
after orgasm for, days after sometimes if they live with chronic pelvic pain or other issues.
Yeah.
But postpartum, sometimes, again, massaging that area as part of play or whatever it may be can help things in that area, especially if you're feeling some of that tension.
Yeah. And what would you say to someone that, they go to try to have sex postpartum and it just is so tight that they're like, I'm never going to be able to have sex again? Like, can you kind of speak about maybe changes that might happen postpartum if you put the work in? And like, can you kind of speak to that piece?
Absolutely. And I definitely had some participants in my research who were feeling this way of, oh my goodness, am I going to be able to have kids again like this, because this is not going
Yes.
well. And so really kind of, having that frustration, that fear, it was difficult for people, I think, to navigate, but really it is something that, with time and with resources, can be improved. So, I would definitely encourage people, because it can feel like a long road at times.
Mm-hmm.
Because I think, what definitely helps in terms of outcomes is that consistent and persistent use of those resources. So whether that's, your pelvic floor exercises or
Yeah.
things like that, use of dilator therapy, finding different ways to, interact with, your partner in a sexual way, during that time. But absolutely, I mean, do not put pressure on yourself, ever.
Yeah.
And no one should be putting pressure on you.
Yeah.
So be patient with yourself. It's okay.
Mm-hmm.
But these experiences, again, we're talking about it today, but in general, they're not talked about. So I think
Mm-hmm.
people also, and it was echoed in my research, can feel very alone in these
Mm-hmm.
experiences of that postpartum pelvic pain, especially if it's, really interfering with their ability to be intimate with their partner in, the ways that they were prior to pregnancy,
Yeah.
or the ways that they want to be.
Mm-hmm.
So it's kind of something that I think hopefully you'll be able to, work on together and have support from your partner in that.
Yeah.
But also, having hopefully that access to support and resources to help with the healing,
Yes.
which does not happen overnight. I talked to a lot of people even at the 6-month mark who were still experiencing issues sometimes.
Yes.
So I think it really, part of it can also be kind of redefining what intimacy looks like for people, whether that's
Mm-hmm.
it's, sexual intimacy or not.
Yes.
But yes, it is something that can be helped and should be helped. I don't want, when it's been a historic issue where, women with any sort of chronic pelvic pain, endometriosis, things like that have not been believed when they've come forward to healthcare providers, which can be difficult in itself to even talk about it.
Mm-hmm.
And then when they do come forward, are brushed off. And that perpetuates even more harm. And so really with this, my message is that your pain is valid.
Mm-hmm.
And your pain deserves to be treated. You shouldn't have to, feel like you have to suck it up. Like, my grandma was probably told after she had 5 kids.
Yeah. It makes me cry because I was told it was all in my head. I didn't have anything wrong with me. It was all in my head. And I fought for years. I was like, there is something wrong. And they finally did exploratory surgery and found endometriosis in several places and did biopsies to confirm. But when that initial is, this is all in your head, like, it's fine, you're not in pain, you're not having these problems, like, I felt like I was so messed, like, then I didn't trust myself, and like it traumatized me. It created a lot of issues, and then all the other pelvic floor issues that came up later on, and it really hindered my ability to get help and reach out to get help to these resources like pelvic floor therapy. And people would, bring up using dilators and these things. And I was just like too traumatized to want to keep talking about it or do anything about it, because I just felt like I was this, I don't know, just odd man out, and it was all in my head. And was I doing this to myself? Was I making it up? Was I just so stressed about it? I was causing my pelvic floor muscles to spasm. Like, it was just, so thank you for saying that, because it was my experience. And I know in my research of endometriosis, just as the example, it's something like 8 to 10 years for the average woman to get a diagnosis in North America. Like, that's insane. And people also talk about, if men were having these problems, there'd probably be a cure by now, or they would, get them tested and get them an answer within a year. But it's when women, especially when it comes up during childbirth and postpartum, that you're having these issues, it just tends to be not as brought forward, talked about. There's this really great, they have 2 locations. They do pelvic floor physio. They're called Bump Physio. Have you heard of them?
Oh, okay. No, I haven't. No.
Okay. They're in Port Moody and they're in Langley. They have 2 locations. But anyways, they make a whole bunch of reels and videos, and in them they have dilators, and they're like showing them and like talking about all these tips and tricks. And it makes me so happy to see, because it just normalizes it. They make it seem like all of these things they do in pelvic floor therapy is just normal health for women. And that's what it should be. We're not there yet, I don't think, as a society, but to them and all these videos, it's just great. It's informational, and it just makes you feel welcome. And it made me be like, I want to go see them for my help. Like, it opens those conversations, and they just make it feel like a lot more of a safe space to bring up maybe some of these concerns. And to be able to talk about, hey, Ed, it hurts and things feel different now, and I don't know what's going on. Like, maybe we could get an assessment and see what's going on and what to do. Anyway, these things, I get triggered. I'm like, oh, this is, but in a good way. We're slowly making progress in, I think, the realms of sexual health and talking about it. And that there are maybe some more resources. And it was recommended to me that sex shops, there's a lot of like very women, not feminist, but like women positive sex shops out there that are actually about like women's sexual health, and that they have a lot of like books and things like that, resources as well, that it's not just like you go in there and they're going to tell you, oh, you should use this toy, or that they're actually very informed about sexual health conditions, and they have books and resources that they can give you, which I thought was very cool. I never would have thought that when I thought about like sex shop and sexual health. I never made that connection before before it was recommended to me. So I thought that was a very it's just different, right? You have these, I guess, preconceived notions that maybe are making blocks to you getting the help that you need. So kind of being more open to talking about it and seeking help. And I think we're slowly getting there.
Yeah, no, we are, I think, slowly. And I think especially after birth too, sometimes there's that feeling of, okay, well, I just delivered a baby. So, what do I expect, like this.
Yes.
And so I think also, there's kind of that piece of like, okay, well, I just had this really traumatic thing happen to my body. Okay, I guess there, is going to be pain and all those things. So, it's not always something that people think about. But as you said, some of those resources, including sex shops, can be great. And a lot more than, kind of your 1980s sex shop.
Yeah,
so,
right? Like, that's just what my like preconceived notion, and it's wrong, but that's what I just had in my head. So it was good to be proven that I was wrong. Do you have on this topic are there any books or website resources that you would recommend?
So Options for Sexual Health BC is a great just general sexual health resource. They're, again, very, I think, open, discuss a myriad of topics, and they're, of course, also pro-choice and, to us LGBTQ plus friendly. So they're a great organization in general. And in terms of the Vancouver area specifically, I haven't been personally, but I've heard very good things. But the women's wear sex shop on Commercial Drive, it's spelled WOMYN, women's wear.
Yes.
But that's one I know in terms of a community sex shop that is, as you said, very kind of women positive and focused on providing accurate and hopefully meaningfully helpful information. So no, those are kind of some great ones as well. I'm in the process of helping to develop some tools that will be both for patients and others for healthcare providers through Perinatal Services of BC as part of kind of their maternal health resources and guidelines, and to have sexual health included on that. Okay. So hopefully that'll be rolled out, sometime in the coming months. But getting kind of some healthcare resources that, again, can be that reliable source of information for people that discuss sexual health, because again, right now there isn't a ton on it. So I developed a handout based on my research. That's just sort of a easy one-page handout on sexual health after birth. Mostly I think for me, it's just a way to start the conversation. It's kind of that initial, way to start it, not only for healthcare providers to provide, give to their patients, but also for patients to say, oh, hey, I was reading this and it kind of brought this up. It just helps ease that a little bit, So, those are kind of some resources that are, we're also kind of working on in terms of the healthcare sphere to support this more, and have that information be out there. But, those are kind of some of the resources in addition to the websites, from the SOGC. So the Society of Obstetricians and Gynecologists have two websites. So it's aplan.ca, where people can go for contraceptive information, and then Sex and You, spelled just you, not YOU at the end. So sexandyou.ca is another one that discusses a variety of sexual health and gender topics and things like that. So that's again from the SOGC and Canada specific.
Okay. I was also going to ask this and I just got sidetracked, but when talking about, I never knew that there's these estrogen creams and things like that available. Would you use that in conjunction with like a silicone-based lube then? Like, is that something that when people should be looking into as well as the lubrication, or do a lot of people find the lubrication is enough? I guess it's probably a very individual how they're feeling, but do those two normally go together, or
they can definitely be used in conjunction? Yeah. So the estrogen cream is something that kind of supports overall tissue, because during and especially with breastfeeding and milk production, estrogen levels are quite low during that postpartum period, and so it can obviously cause things like vaginal dryness and discomfort with sexual activities. So the estrogen cream, again, is provided by a prescriber. So midwives, nurse practitioners, physicians can all prescribe it. But yes, that would be something that I think can help just with, general tissue health and helping things feel more comfortable.
Mm-hmm.
Um, and helping to kind of supplement that lack of hormones that is existing in that time.
Yep.
And having just an
Yep.
effect on, the local tissues. So, systemic estrogen comes kind of with it's a bit of a different discussion, again, depending on, your health history and things like that. But for most people, the, topical local use of estrogen is safe. And then in terms of
Yep.
the lubricant, I do encourage that. Sometimes people can use it, day to day, but especially kind of with any sort of sexual interactions. I recommend this water-based or silicone-based lubricants. Yes.
Okay. Yeah, interesting. I love that because I learned something new, and now hopefully everyone listening will also learn something new, that if they're experiencing this, that maybe it's a question to bring up to your doctor about this estrogen cream as well. And so I think that's great. Are there any other, you can think of, like the tips or tricks you talked about, or anything else that you would say to someone that's kind of struggling with their sexual health postpartum?
I think, we talked a little bit about, the physical pieces and navigating some of those changes. But, another big one that comes up is discussion with their partners and kind of
Mm-hmm.
sexual communication, for lack of a better word. So I think with kind of approaching that too, sometimes it's tough because I think for some people it's sort of like, how do I bring this up? And then talking with their partner, it's but both partners are kind of assuming what the other one is maybe thinking, and then there's actually no communication there.
Yes.
And
Yep.
it's sometimes easier said than done, and I definitely acknowledge that. But I think
Mm-hmm.
for some, kind of using that 6-week check as a way to have a conversation, and it's sometimes, I think, again, that pressure of like, oh, okay, like this is when we're supposed to be ready, like how's my partner feeling? Are they excited about this? Are they expecting this? Are they not? And so even
Yep.
kind of prior to it, sort of having a way to kind of touch base of, okay, my
Mm-hmm.
physical recovery is here. And it's nothing personal either. I think for some, they really still want to show affection to their partner and have intimacy,
Mm-hmm.
even though it can be hard to find time to, even be alone,
Yes.
to just cuddle on the couch together or things like that as new parents.
Yes. Yep.
But
Yep.
just really communicating that, because I think for some it sort of can be tough in terms of needs and still, making that time for intimacy. So we
Mm-hmm.
give some kind of examples in tools, and we're developing this as part of the tools through Perinatal Services of BC. But talking about each other's needs, and whether that's in terms of their health and also sexual intimacy. So an example of that could
Mm-hmm.
be sometimes when you turn away from me in bed, I feel like you don't want to be intimate with me. Would it be okay if we tried having some time to cuddle and kiss, right before we went to
Mm-hmm.
sleep, or things like that, because I still would like to share intimacy in that way, or whatever it is, right? Like just finding those little ways
Yes.
to still show that affection to your partner, if that's something
Yes.
that's desired. So that's also kind of something that I think comes up, is that that piece of, yes, okay, you maybe know what's going on in your body and your thoughts, but hopefully opening up to
Yes.
that partner, and then also dispelling, I think, some of those, again, hidden assumptions, or of, okay, how are they feeling about returning to sexual activities? Are
Yes.
they wanting it? We always see all those TikTok videos of my husband
Yep.
after the 6-week check when I get home, and like, you know what I mean?
Oh, yes.
And
Yeah,
they're
yeah, yeah.
eagerly waiting for
Yeah.
the return to sex kind of thing. So it's all out
Yes.
there,
Yep.
right? But again, we know that each couple navigates that in their own way. And for some people in
Yep.
my research, they said, I'd be scared to say that, my partner and I haven't been sexually active, at 2 to 3 months postpartum or whatever it was, because people would
Yep.
think that there's something wrong with the relationship. And that is so
Yep.
normalized in our
Yeah.
society of, having
Mm-hmm.
sexual activity. I think especially penetrative sexual activity being
Yes.
seen as sort of the best or most valid way to share intimacy in your
Yes.
relationship. And again,
Yes.
postpartum, sometimes that's not necessarily realistic. It's not necessarily what people are wanting.
Yep.
And so, yeah, finding, again, different ways to still meet those needs. And that need for emotional connection was something that, the people in my research definitely did talk about.
Yep.
And yeah, hopefully have a conversation with your partner that facilitates that open avenue for communication, and, that
Yes.
trial and error, if and when you are kind of ready to start, having those sexual interactions
Yep.
again, having it be also open to the ebb and flow, because sometimes it's not always,
Yes.
the smooth ride. There'll be laughs, there'll be
Yes.
kind of mistakes
Yeah.
or whatever, right? Like it's
Yes.
Again, it is kind of navigating something new in a way, which can be exciting, of that postpartum
Yes.
and this
Yep.
experience that you've both gone through together of, the pregnancy and the birth and the bonding that also happens
Yep.
with that,
Yep.
but also all the fatigue and the new responsibilities as parents. All these other things you're
Yep.
also navigating.
Yep.
So no, also being open to the ebb and flow, the trial and error. So
Yes. I think you bring up a good point of that. Yeah, intimacy doesn't have to mean penetration. And I think a lot of people, there's that expectation or idea that is like, oh, to be intimate with my partner, we have to have penetrative sex, right? Like that, I think that's just out there in society. So I think really bringing awareness to the fact that there's other things and just cuddling, like a lot of spouses just want to feel close again because I can tell you when I have hyperemesis and I'm puking my entire pregnancy and on the bathroom floor and just feeling awful, like we never snuggled in bed. Like there was like, I was just so sick and he was taking care of our toddler that like we were hardly even in bed at the same time because we were all doing all different things. So, like there's things that, like you said, you're not mind readers. You have to talk to your spouse, your partner about these things because maybe that's all that, your partner is wanting is just to hug you and snuggle on the couch again because it's been months since you've done that. And so to be able to actually be open and have these discussions and realize that you're not reading each other's minds, that you have to actually have these conversations. And Karlee gave a great example of this. I wish she was here to talk about it, but her husband actually was like scared to have sex with her because he was assuming that she was in pain and she didn't want to have sex. But she was thinking that he wasn't attracted to her and that he was not wanting to have sex or initiate it with her because he wasn't attracted to her as much postpartum. So they're both having these kind of like, oh, the other person isn't ready and doesn't want to have sex. And then they just never talked about it. So finally one day it came up and I don't remember how she said, but it finally came up and they're like, oh, I thought it was you. And they were like, no, I'm ready. No, I'm ready. And then they realized they were both ready, but they were both on these totally different wavelengths. And they could have had this conversation probably a month or two prior, but they both just were, fortune telling. They're both just, guessing what the other person was thinking and they were completely wrong. So I think encouraging those open conversations with your partner is super important.
Yeah,
so
totally.
thank you for touching
And
on that too,
we
because
see that, very commonly where, thankfully people's partners are often wanting to, be supportive, be respectful, and not want to have any pressure or perception of pressure of, oh, okay, so do you think you're ready to have sex? And if I ask that, how would they perceive it? So again, it can be tough to approach, but even starting before the 6-week mark of, okay, so, I know sexual health can be kind of a part of this. So how are we feeling emotionally? How are we feeling physically? But no, definitely a common story. And I'm really glad you shared it because, we hear that all the time. And again, it's easier said than done sometimes, right? So,
for sure.
But no, that's great. Yeah.
So I guess I like that you're also kind of putting that more positive spin on the 6-week appointment. Cause I think right now a lot of people it's very negative. Like they didn't do anything. I was in and out in 5 minutes, nothing's getting done. But I think that at the very least, if it can help you and your partner start having these conversations about how things are feeling, how you are feeling about it, how are they feeling about it, because maybe it's just enough to know that you have this appointment or right after you have this appointment that you start being able to have these open communications that's super positive. If that's what can come out of your appointment, I think that's a great for your relationship and for your sexual health as well. So a good little positive spin on maybe the 6-week appointment as well.
Definitely. Yeah.
Yeah. Is there anything else you can think of before we end today's podcast episode?
No, I think we touched on, a lot of kind of, themes in my research and clinical work as well.
Yeah.
So, kind of talking, I think, about those practical things too. So, I hope people will find this helpful and hopefully validating or uplifting or just a source to say, hey, okay, this is gives me a bit more clarity, even if some. Exactly.
Yes.
Exactly.
Yes.
No, I think that's great.
Thank you so much. I appreciate you being so open and just, available to come on the show today and talk about these things. And my hope is that hopefully in the years to come, this is more normalized. We talk about it more. Everyone's talking about it. It's, it gets brought up in your 6-week appointment and just in other doctor's appointments that you bring up sexual health too, because there's a lot of conditions like vaginismus and vulvodynia that I think people might have and not be ever diagnosed because they're too afraid to bring it up to their doctor. So it's interesting to me. It's an area that I've always thought of too, is that maybe this needs to be part of other, yearly doctor's appointments where they start asking about sexual health. And I just don't think that's there yet. But I think it's great that you're starting this and doing this work in postpartum sexual health. So thank you very much, Dr. Ollivier, for being on today, Rachel. And yeah, thank you so much.
All right. Thank you.